This is Group 7. Our strategies presentation is over ethical decision making in advanced nursing practice. These are our assignment objectives. Ethical dilemma is defined as situations in which obligations require that individuals adopt each of two or more alternative but ethically acceptable incompatible actions, such that the individual cannot perform all required actions. Autonomy is defined as the duty to respect others' personal liberty and individual values, beliefs, and choices. Non-maleficence is defined as the duty to respect others' personal liberty and individual values, beliefs, and choices. Beneficence is defined as the duty to do good and prevent or remove harm. Justice is defined as the fair, equitable, and appropriate treatment in light of what is owed to persons. Veracity is defined as the duty to tell the truth and not to deceive others. Fidelity is defined as the duty to honor commitments. Confidentiality is defined as the duty not to disclose information shared in an intimate and trusted manner. Privacy is defined as the duty to respect limited access to a person. Ethical decision making in nursing refers to the ability to make the most appropriate decisions about ethical issues based on intuitive, ethical nursing principles, professional values, codes of moral judgment, and moral reasoning. In the profession of APRNs, they are expected to demonstrate everyday ethical values and they must hold a strong competence of ethics in their practice. APRNs must demonstrate everyday ethical comportment and to integrate a strong moral competence into every aspect of nursing practice. APRNs act as role models in recognizing and resolving ethical problems, creating ethical practice environments, and promoting social justice in the larger healthcare system. The goal for providers is to identify ethical situations and the unique circumstances while also identifying their own response to the situation. Moral sensitivity is the capacity to sense the moral significance of the situation. The APRN must distinguish between feelings, facts, and values and reflect on these to determine what is appropriate. With moral sensitivity, we must recognize the existence of the ethical issue, patient's vulnerability, and impact of the issue. APRNs need to be able to identify and separate their own emotions of the situation and their own personal response to it, successfully assess and intervene in an ethical situation. Professional values is a variable that influences the ethical decision-making process. An individual's cognition and attitude towards the nursing professional career and pursuit, which can guide decisions with ethical issues, resolve conflicts, enhance the quality of care, and increase the job satisfaction of nurses. Self-reflection is essential for the APRN to cultivate sensitivity to their own emotion and hidden biases. A self-reflection will minimize the risk of an emotional response during an ethical situation, which will help to foster strong moral agency. Applying the ethical decision-making process. First, we want to identify the problem and gather information. Focus on facts, not assumptions. This can include clinical indications, patient preferences, quality of life, or contextual factors. The APRN should not stop here. Second, determine the type of ethical problem. A strong emotional response to an issue can signal that an ethical problem exists. Third, use ethical theories to analyze the problem. Fourth, explore practical alternatives. Use imagination for a wide range of alternatives. Be diligent in assessing feasibility of actions chosen. Fifth, implement action. The APRN must be motivated to carry out the action, which can be difficult. Not acting at this point is a conscious choice that can carry consequences. Lastly, evaluate the process and outcome. What went well and why? Can this be applied to other scenarios? Evaluation should be addressed the reality of lingering feelings and the related tensions that they create. The APRN's ethical decision making is guided by ANA Code of Ethics, State Practice Acts, hospital-made protocols, and personal morals and values. These are some of the common factors that go into ethical decision-making. The APRN must use self-reflection, moral sensitivity, ethical frameworks to apply ethical decision-making for their patients. APRNs are often the first-line ethical decision makers, especially in primary care, acute care, and underserved settings. Lastly, ask questions. Some questions to consider during ethical decision making are: what ethical principles apply to the situation? What are the potential consequences of this decision? Am I using my own morals and values in this decision? Principle-based approach uses core principles to assist with the ethical decision making. Casuistry approach is a case-based ethical method focusing on analytical reasoning. Narrative ethics uses the patient's individual story to make ethical decisions. Care-based ethics is a moral problem described in terms of relationships with others. For example, in a study done on nurse midwives using the principles-based approach, Dunn found that using the 4 principles of ethics in nurses' decision-making promotes patient safety and advocacy and maintains the integrity of the nursing profession. As future APRNs, we can use this principle-based approach to ensure patient safety and advocacy as we are supposed to do. It is vital that we use these studied approaches when it comes to ethics as it is important competency to have. Here's an example. An APRN in a palliative care setting is caring for a terminally ill patient whose family is requesting aggressive treatment, despite the patient's advance directive for comfort care only. The APRN must honor the patient's autonomy and legal wishes while communicating compassionately with the family and advocating for appropriate end-of-life care. Here's another example. A teenage patient reveals suicidal ideation, but begs that the APRN to not tell their parents. The APRN must balance confidentiality with the duty to protect the patient from harm, involving mental health services and notifying appropriate parties while minimizing breach of trust. Here's another example. A long-term patient with chronic pain requests a refill of opioids, but the APRN notices signs of possible misuse. The APRN must consider non-maleficence, do no harm, avoid enabling substance abuse, and explore alternative pain management strategies, even if it leads to patient dissatisfaction. Another example, an undocumented patient requires care but fears deportation if they seek services. The APRN upholds the principle of justice by ensuring equitable care regardless of immigration status, while also maintaining confidentiality and advocating for the patient's access to safe healthcare. Here's another example. The supervising physician insists on a treatment approach not supported by current evidence. The APRN must use their clinical judgment and commitment to evidence-based practice to respectfully challenge the approach, advocating for safer and more effective patient care. Ethical decision-making ensures that care is patient-centered, respectful of autonomy, and evidence-based. This promotes trust, adherence to treatment, and overall health outcomes. Having a structured ethical strategy helps APRNs navigate challenging clinical situations, reducing feelings of guilt or regret. This improves provider well-being and job satisfaction. Ethical practice demands recognition of diverse values, backgrounds, and beliefs. This fosters equitable, inclusive care tailored to patient needs. Fast-paced environments can limit opportunities for reflection or consultation. This can lead to rushed decisions without full ethical consideration. Ethical ideals can clash with real-world constraints like limited staff, financial issues, or unavailable treatments. APRNs must balance ideal care with what's feasible. Repeated exposure to ethical dilemmas without resolution can lead to burnout, compassion fatigue, or moral injury. especially in end-of-life underserved settings. Ethical decision making is a common and difficult topic that APRNs face in their work environment. APRNs should be able to reflect on their own personal biases to deliver ethical principles to the patient, the family, and their coworkers. The APRN should know how to resolve ethical dilemmas to best benefit the patient, family, and staff.